Righty, so spring cleaning is important to get rid of the clutter, right? So tidying up your medicine cabinet is important too.
Yeah, so we are joined by Dr. Gautam Desai, professor and chair of primary care at Kansas City University. And we talk about spring cleaning, but this is a serious level, a serious lens of which to talk about spring cleaning, because we're talking about the medicine cabinet and potentially deadly things lying around, right?
That's correct.
All right, so what's the best strategy here?
What we do?
So every, maybe once a year, set a calendar appointment and then look at the medications that you have, especially those prescription ones, and see if they're expired or out of date. And if they are, you don't want to just randomly throw them in the garbage. Take a look at the website if you have access. The Food and Drug Administration has places where you can go to drop off unwanted medication. And then if you don't have access to those, you can also flush some down the toilet. They have a list of what's considered safe. If you can't do that, then you have to get rid of them in the garbage. So you mix it up with something that, like coffee grounds or litter, and then put it in the garbage. Don't try and crush it or grind it up or anything.
Yeah, I heard cat litter is something that you can use to mix it up and get rid of it. Okay. So I know another thing, when it comes to the bottle, like you had that, can you reach for that, Pat? Yeah. Like you've marked it out. When you throw these bottles out, you're supposed to mark them out?
Yeah, that way people don't go dumpster diving and find your personal information online. It's just one other thing you can do to kind of protect yourself. And sometimes people will, take these and recycle them, or they'll put them to other good uses too.
And what are some ones, Dr. Desai, I'm just curious, that like people probably don't realize, like, oh, well, I have a prescription for whatever, but that are prone to be either abused, or a little kid, eats a couple of them and,
Yeah, that's where the opioids come in. So a lot of people have chronic pain and they take medications. Sometimes they're trying to throw away expired ones. And those are the main ones that are on the FDA's flushable list. So most stuff you don't want to flush, but the risk from a child or a family of opossums coming in contact with some opioids can make it better to get rid of it in the toilet versus in, say, a dumpster.
Okay, and families should be going through medication yearly, every 6 months, how often?
Yeah, every year. As you go through your home first aid kit, if you have one stashed away, just set a calendar appointment and then go through the meds and say, hey, this thing's expired. Or sometimes if people have passed away and you have their old medications, you need to get rid of them in a safe way that won't affect the environment or people.
Yeah, no, it's interesting, because it's scary now with all the different things we're hearing about opioid addiction and,
fentanyl overdoses and things like that. So yeah, very important. Anything else you want families should know?
Just having their medical history and maybe a first aid kit inside of a waterproof plastic container that you have somewhere in the house. Put a week's worth of meds in there, and then some common emergency medicines, some wound care stuff would just be a great thing. And for your car, there's a tool you can use to smash a window or cut a seatbelt. With electronics, sometimes they stop working, so it's nice to have a backup to open the car door if you're underwater.
Oh, geez, that's a great. I've seen those little gadgets. Do you have one of these?
Yeah,
that's what that is. Okay.
Cool.
Awesome.
Yeah, so
because if you're underwater, good luck, you're not going to be able to open the window. You're going to get one of these.
Just things that we should keep in mind, like checking, make sure we have yearly. Okay.
Awesome. Good stuff, Dr. Desai. Thanks so much for coming in.
Thanks so much. Always
My
a pleasure.
Be safe.